Hello again, everybody. Today is Wednesday, the 14th of April. Welcome into another Keep Boone Healthy Community Information Channel video update on the Watauga County vaccine deployment efforts. We have our usual crew of suspects, two of them, and one new face to introduce you to today. Of course, as always, we're joined by Jennifer Greene, Director of Public Health for AppHealthCare, Sean Burroughs, the Director of Pharmacy for Appalachian Regional Healthcare System, and new with us today, Jason Marshburn. Jason is the Director of Environmental Health, Safety, and Emergency Management at Appalachian State University. And as we have talked to you the last few times, we have mentioned Appalachian State getting more involved in that process of beginning to vaccinate not only folks on campus, but the community at large as well. So we thank Jason for being here. There's a lot of discussion going on around the vaccine topic here over the last few days. Jen, we're going to start first with the elephant in the room, and that is the J&J pause, the pause of the Johnson & Johnson vaccine. Can you give us a little bit of the why we are sitting here and what this is and is not in terms of reaction to certain things that have gone around statewide and nationwide?
Look, I think it's a really good point to underscore the word pause. What this is telling us is that the safety mechanisms that we have in place are working. When you come and get a vaccine, there is a Be Safe program that hopefully your vaccine provider is telling you about, because that's how the CDC is tracking any adverse experiences. Plus, they're also asking all of us as providers to report them. And so what we see here is 6 cases out of over 6 million, almost 7 million vaccines that have been administered. And so I think what this means is let's take a pause, let's take a deeper look and see if we can understand what's going on here. I think it's really important that the community knows that these systems are in place for a reason, and this is telling us that that system is working.
So this pause was enacted by the CDC and the FDA. There was also some communication that came out of Raleigh over the weekend about some issues with the J&J vaccine down there. Can you kind of differentiate the two for us and the differences between those two shots of news, if you will, no pun intended, about the J&J vaccine?
Yeah, so that was a pause that was really just taking a look at a different type of issue. You know, you can have some issues with dizziness or fainting if you are dehydrated, if you're coming into a clinic and you're not, you haven't eaten all day. And you know, for a lot of reasons, those providers in that area decided to take a minute to pause and look at things, but they didn't see any concerns at that point. So this is totally separate from the pause that's been announced by the FDA and CDC. And that's really an important distinction.
Sean, you have been our go-to resident person on these videos to help us walk through what the vaccine process looks like from a medical perspective through your role as Director of Pharmacy. What can you tell us about 6 and 6.5 million and what this pause is designed to do and what it looks like on the other side? What will it mean when J&J vaccine is available again? What would have had to have been accomplished to get to that point?
Yeah, as Jen mentioned, this is done out of an abundance of caution, which is a great thing because we want the public to be comfortable and confident in continuing to receive the vaccine. What they've done is they've paused to analyze the 6 cases that they've identified and try to figure out if there's a common reason why those 6 in particular may have developed this very, very rare clotting disorder. Again, it's really hard to find a pattern with just 6 cases. So I think they're going to analyze the data. Obviously, they'll make the public more aware of what to watch out for, as they have done with the providers. When people come into the offices, the providers have been made aware of different signs and symptoms to look out for potentially this rare clotting disorder. But again, it's really hard to find a lot of information and patterns based on just 6 cases. So I imagine they're going to analyze the data. And again, 1 out of over 1 million is very rare, and there may be more cases that are identified now as awareness occurs. But I my guess, and that's all it is right now, is that after the pause, after they've maybe been able to identify certain risk factors that put people more at risk for this particular clotting disorder, there'll be some guidance on the backside of it, but we will continue most likely with vaccinations. But the time frame of that, I'm not really sure if it'll be days or weeks.
And also important to note too that this is a J&J pause, or the pause with that Johnson & Johnson vaccine. Has there been anything about slowing or altering at all any of the rollout of Moderna or Pfizer vaccine at this point?
No, and that's one of the benefits of having different options. The Moderna and Pfizer vaccines are still available and going just as well as they have since we started the rollout back in middle to end of December. So those folks that may have been waiting for Johnson & Johnson and now we're in this pause with the Johnson & Johnson vaccine that still want to get vaccinated, there's a plethora of different options out there, be it at pharmacies, be it at ASU, be it at the health department or the health system, for folks to still be able to get vaccinated.
And that's a great segue into bringing Jason Marshburn into this conversation. Jason, I know that Appalachian State recently had a J&J vaccine clinic. We saw an announcement earlier this week that Moderna would be administered at your next big clinic. So how are you working within, again, the campus community, as you have vaccinated a lot of folks that come in contact with Appalachian State, but the community at large to help them understand why shifts have been made the way they have been, and really to give them opportunities to get educated on the different types of vaccines and what might be right for them?
Yeah, absolutely. The university is very happy to be able to offer vaccine clinics and work with our community partners and continuing to help in the vaccination efforts. And we appreciate the great partnership that we have with AppHealthCare and others to be able to offer the Moderna vaccine this week as we transition. And so we continue to work with our community. We encourage whether it's students, faculty, or staff, or general community to continue to evaluate their options. We encourage everyone to get vaccinated, certainly take advantage of the first opportunity they have to receive a vaccine, but we do want people to be comfortable, and we do want them to be able to evaluate their different options and have an understanding about their vaccine. So whether it's on campus, we certainly want to make resources available for people to take a look at, or encourage them to look at other resources that are available through public health and other providers, or talk to their medical provider if they have questions. For students, they certainly have the option to contact Student Health Services on campus. They're a great partner and they help them administer the vaccines on campus. They're always happy to answer questions and address any concerns that someone may have. Of course, there are other resources as well, whether it's a personal provider or again through public health. But certainly want to make that information available, and we want people to be comfortable as they come in for their appointments.
Jason, I think it goes without saying that a lot of folks in the community, because of Appalachian State's large student population, just kind of curious as to how the information about and the opportunity to get vaccinated is being received by that student population as they get ready to, some of them, the vast majority of them, transition out of the community for a little while here in the next month or so. Have you noticed that people, whether they choose or have chosen to get the shot yet or not, have they been requesting those resources and engaged in the process to the liking of campus right now, to the point where you feel good about people are trying to make the informed decisions that we all want them to make?
That's a great question. We certainly see individuals asking questions, which is great. We've seen a lot of enthusiasm for being able to get the vaccine and having access to the vaccine, whether it again be through the campus clinics or any of the clinics in the community. And we really started getting questions back in January. People have been enthusiastic and excited since that point. Of course, we're very optimistic about the future, and we hope that we'll see lots of good things to come as we continue to vaccinate the population. So we're seeing a lot of great interest. We've heard a lot of great questions. People are taking, whether it's again students, faculty, staff, community members, they are taking the steps that they feel they need to take to get the information they need to make a good informed decision and move forward. So we've been happy to see that.
Jen, I know with that said, getting to that student population was a benchmark that we talked about for quite some time in this particular forum over the course of the last few months. Now that we've gotten there, a lot of community members starting to focus toward even younger populations, and we know that there continues to be study about that next group of high school age students that might be able to see their number called for vaccine purposes. Do you have anything to update on what that timeline looks like or what that research looks like right now to see about lowering that age of eligible vaccines and vaccinated patients?
Well, I'm really excited to tell you that we're got some plans in the works with Watauga County Schools, the great team at Boone Drug and Samaritan's Purse, and trying to organize a clinic specifically just to make it available and easier for high school students. But we also know Pfizer has submitted data to the FDA for 12 to 15-year-olds. So we're really excited about the opportunity to watch that because that could be, coming before too long, where we're able to get even middle schoolers vaccinated, which is such a great thing to think about, as we wrap up the school year to be preparing for summer.
And could you give us kind of an overview, numbers wise? I know people always like to get that data. Where does Watauga County stack up in terms of percentage of population vaccinated, that type of thing?
Well, I'm really excited. We are at over 29% partially vaccinated and about 29% fully vaccinated. So yeah, we're over 58% with some level of vaccine, and that is so wonderful. And yet we still have some room to go. So we know that really, I would love to see us hit a 70% mark by July 4th, and even further as we go into the summer. We've got to continue to vaccinate as many people as possible, because that's really what's going to help us get that community immunity that we are looking for to stop the spread of COVID.
So with that said, I know you all are engaged in vaccine operations, and I also know that those operations may take on a different look as deployment continues and we see more people vaccinated and maybe less need for mass gathering opportunities and taking those into some different things. And we'll get into that conversation in more detail once we get to that point. But Jason, maybe we'll start with you. I know that Appalachian State, as we record this on Wednesday the 14th, on Thursday the 15th, there's another big community opportunity for vaccine on campus. Can you tell us a little bit about that?
Absolutely. So our next vaccination clinic that we're hosting on campus is Thursday, tomorrow, April 15th, from 10 a.m. to noon in the Holmes Convocation Center. Certainly encourage anyone interested to take a look at our scheduling page, which can be found just by Googling App State Vaccine Clinic, and it'll bring up the scheduling page, and there's a link on there that individuals can follow. So we encourage anyone to take advantage of that opportunity. And we hope to continue offering clinics on a weekly basis. As long as there's a demand, we'll continue to help support community vaccination efforts.
Excellent. You get an A for not only vaccine deployment, but for search engine optimization for Googling App State Vaccine Clinic. That's a great resource to share. Sean, can you tell us a little bit about what Appalachian Regional Healthcare System is doing right now in terms of its vaccine schedule for the next little bit?
Yeah, today we're finishing up a first dose clinic at the community rec center, and I think we are going to start transitioning next week into smaller clinics in our App family or Baker Center out in Avery County, where we're going to try to hit folks maybe that haven't been able to come during the morning or afternoon sessions of these mass clinics, and maybe do some evening clinics. Because we really have noticed that because of the different options people have and the accessibility of the vaccine at different locations, as you mentioned, the mass clinics, the larger clinics don't seem to be attracting as many folks as they were, which is a fantastic thing. To Jen's point, that means that a lot of people have been vaccinated that wanted to get vaccinated. So ARHS is going to be moving more towards a smaller clinic location as we were before we were using the Watauga Rec Center.
Well, and certainly that scheduling flexibility, music to the ears of a lot of employers here in the community that continue to try to balance that need to get employees vaccinated with scheduling to keep the business running. So we appreciate all of you for doing that. Jen, what can you tell us about AppHealthCare and the way that you're handling your side of the vaccine scheduling world?
Yeah, well, I think similar to what Sean said, we've been doing larger mass clinics, and we probably will continue as we have second doses in high volume to use the recreation center. But we will probably be transitioning to smaller clinics and perhaps offering at our office, but also continuing to think about how do we take vaccine out in the community. We're still doing people who are homebound. So if you know someone who needs a vaccine, do let us know about that, because that's something that we are continuing to do. And of course, we want to partner with other organizations. If they want to host a clinic at a church or a school, we'll be continuing to think about ways that we can do outreach with vaccine in the months ahead.
Wonderful information from all of you. And as we often do, we will link all of the scheduling information, not only for the providers that you see here today, but also Boone Drug has been very involved in that as well for the last several weeks. And we'll make sure that there's a link to their scheduling information. Like you have heard Corey Furman share before, Boone Drug continues to use their retail centers as vaccination distribution points, and will continue to do so as they schedule those slots. So be on the lookout there. We appreciate everything that you all continue to do to keep our community informed on this ever evolving process. And hopefully we'll have more news to share here in the future, and even better news as we work through the vaccination element of this COVID-19 excitement that we have been dealing with for a year plus. So thanks to each of you for joining us today.
David, I would say Jen had the catchphrase to take away community immunity. I thought that was great. So we'll take that away.
Well, I'm thinking that, I know we talked about Jen and the vaccinators being our band, but I kind of like, some of the other terminology that's been used, so community immunity might be our band name now too. Who knows? You guys take care.
Thanks, David.
Thanks, David.
Thank you.